welcome to our special program. I'm Gargi Rawat. COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization. But some go through complications and hospitalization. There have been various discussions and theories regarding the interplay of hypertension and COVID. People earlier believed that hypertension predisposes them to COVID. However, complications like the new onset of diabetes in post-COVID patients is causing further complications to the management of hypertension. This complex interplay of diabetes, hypertension and heart disease needs to be understood so that it can be managed better. Today we have a panel of experts with us to help us understand the complex interplay between hypertension and diabetes. We're joined by Dr. A. Muruganathan, Chairman, AG Hospital, Tirupur, Dr. Mandeep Saini, MD, Internal Medicine, a consultant, internal medicine, Fortis Hospital, Ludhiana. Thank you so much, doctors, for joining us on the program to answer all our questions. And Dr. Muruganathan, I'd like to start with you. Due to our changed lifestyle during the COVID pandemic, the risk factors of hypertension have actually increased for almost everyone. Is the risk of hypertension different from males and females? And among them, who is at greater risk?
Yeah, you are right. The uncontrolled hypertension during COVID is the culprit and the hidden terrorist responsible for premature heart attack, brain attack, lung attack, leg attack, eye attack and nose attack. In fact, the risk factors are common for both male and female. But, compared to male, the female's risk is little less because, the main risks are obesity due to sedentary habits, TV watching, overeating, stressful situations such as anxiety, depression, frustration, sleeplessness and anger, especially during COVID due to environmental factors, consumption of excess fat, obstructive sleep apnea, excessive smoking, excessive intake of alcohol, air pollution, frequent use of ephedrine containing nasal drops, especially for the cold and things like that, causes high risk. When you see the high risk, both male and female have the same high risk, but the male members, when they go out for various activities, their risk of developing COVID is also more, and as they age, their risk is more. So compared to male and female, according to my statistics, what I see, males are more, getting this problem. But one important aspect I must, stress: control hypertension is the key. If you control the hypertension, the risk is less. So to reduce all these risk factors for both male and female, what they should do is they should be in the state. They should not be in the state of anxiety. They should be calm. Manage stress to the normal blood pressure. Sleep well for at least 7 to 8 hours. Be disciplined. Eat at the right time, right dose, right place, in the right manner, in the right environment. Consume more green vegetables, fruits, nuts on daily basis. Don't overtreat. Control blood pressure. Use home blood pressure monitoring. Right. Reduce salt intake. Be cholesterol fit. Reduce obesity, control diabetes, reduce alcohol, manage stress. By doing all this controlling of the risk factors, the risk for COVID is definitely less. But as I see now, male members are more developing this risk, and controlling hypertension reduces the risk for developing COVID, and controlling the hypertension also reduces the mortality and morbidity.
All right, a lot of steps to take to control hypertension, from your diet to your marriage life and all sorts of tensions that you may have. Dr. Saini, hypertension acts as a precursor to diabetes. It is also observed that most people with diabetes are also at increased risk of developing hypertension. Can you expand on what are the common causes of hypertension and diabetes, and how are hypertension and diabetes then linked to each other?
We have been examining many patients in our daily OPD with both the comorbidities, diabetes along with hypertension. Basic causes are known, but it came to our notice obesity, lack of exercise, high intake of salt, junk food, smoking, alcohol plays an important role in both these diseases. So we have to fix our diet and exercise daily according to our disease. We have to take 2200 kilocalorie diet in 24 hours. We fix it as 50% of our as carbohydrates, 30% as protein, 10 to 15% is fat, and 5 to 7% is our fibers. So we fix our diet according to this. And 20 minutes brisk walk or yoga, meditation, cycling, swimming. Many patients ask me what to do in COVID time. So we can perform many exercises at home also, like climbing stairs, skipping, jumping, push-ups against the wall, and stationary cycling.
All right, and Dr. Muruganathan, what is white coat hypertension and masked hypertension, and which one is clinically significant, and how can one differentiate between these two different types?
When somebody comes to the clinic, when they see the doctor with white coat, nurses with white dress, their blood pressure because of the anxiety increases. So the blood pressure in the clinic is increased, whereas when you check the blood pressure at home with home blood pressure monitoring or ambulatory blood pressure monitoring, that pressure is not there. So this is called white coat hypertension. The opposite is called masked hypertension. What is masked hypertension? When somebody comes to our clinic, if you check the pressure is always normal. And when you go home and then check the pressure with the home blood pressure monitoring or ambulatory blood pressure monitoring, the pressure is more. So the masked hypertension is more dangerous than white coat hypertension. Of course, white coat hypertension also in the long run, according to Puma study, you should monitor them periodically because these are the candidates who are going to develop hypertension later on. But masked hypertension is more dangerous. How do I identify masked hypertension in the clinic? Somebody comes to you in the clinic, when you check the blood pressure is normal, but the target organ damage due to hypertension is more. For example, they may have eye changes, they may have ECG changes, they may have urine albuminuria. So when you get the secondary organ damage problems, when the blood pressure is in the clinic is normal, you think and suspect masked hypertension. Ask the patient to do home blood pressure monitoring or ambulatory blood pressure monitoring at home, and you can diagnose masked hypertension.
All right, so it's important to catch it early. Dr. Saini, a close link exists between diabetes and cardiovascular disease. How does diabetes mellitus increase the risk of cardiovascular events in patients with hypertension?
Both diabetes and hypertension can lead to cardiovascular disease. High blood glucose level can damage our blood vessels and nerves that control our heart and blood vessels. Diabetes also lead to atherosclerotic changes in our vessels, means accumulation of plaque in our vessels, leading to thrombus formation and heart attacks. In hypertension, heart has to work harder against the resistance, which ultimately lead to damage in our blood vessels and to cardiomyopathies and heart attacks. So we have to control our blood sugar levels and BP, blood pressures very strictly. We can buy simple BP apparatus or glucometer from the market, and we make a record on weekly basis or daily basis, and in case of high readings we can approach to a doctor or hospital nearby.
All right, Dr. Muruganathan, during the pandemic, people were very hesitant to go to doctors to check their blood pressure. Many people even purchased home monitoring devices to measure blood pressure at home. But are these devices then accurate, and what is the correct way to measuring blood pressure at home?
In fact, in India, the usage of home blood pressure monitoring is slowly increasing. Only because of COVID, when there is a lockdown, patients cannot come to hospital. They don't want to come to hospital. So that time only this home blood pressure monitoring is getting popular. It's a blessing in disguise. There are a lot of validated home blood pressure monitors available in our country. So when you have the home blood pressure monitor, what you should do, you buy the home blood pressure monitor, go to your doctor or the nurse or counselor and find out how to check the blood pressure. You see, there are some precautions you should do or take when you take the blood pressure. Accurate blood pressure measurement is the key. If you measure wrongly, then it will give wrong value and you will have wrong treatment. So before taking the blood pressure measurement, you should not smoke, you should not take coffee, do exercise 30 minutes before. It should be a quiet room at a comfortable temperature. You take 3 to 5 minutes rest before you check the blood pressure. No talking, especially with the mobile during or between the measurements, and you empty the bladder. And when you sit on a chair, back supported, Cuff to fit the arm size. You must have cuff size, correct size. And arm bare and resting mid-arm at heart level. Mid-arm should be at the heart level. And then you should also validate the electronic BP apparatus and cuff by the company and see the validated BP monitors. Take 3 measurements at 1 minute interval. Use the average of the two. And then your feet should be on the floor. You should not cross the feet. So when you observe all these correct measurement and method, the blood pressure what you measure is very good. There are good validated BP monitors available, and that will be good. But anyway, you are allowed to take your BP monitor to the doctor and recheck whether you are measuring rightly or not wrong. And the doctor will also standardize with their BP monitors and will advise you properly. So my message, home blood pressure monitoring should be promoted, popularized, and in every house there should be a home blood pressure monitor.
We'll slip into a short break. We're talking about health, diabetes, and managing hypertension. We'll return with more questions. Stay with us. Welcome back to our special show. We're talking about health, diabetes, and managing hypertension. Dr. Muruganathan, what blood pressure targets do guidelines recommend for Indians with diabetes and chronic hypertension? Why is it different?
One of the important points I would like to drive home to every listener, whenever you go to any hospital for any problem, maybe little finger injury or fever or headache, you should check the blood pressure. You must make sure that your blood pressure is checked, especially when a diabetes and hypertensive patient, because I've already told you diabetic patients will develop hypertension patients will develop diabetes. It is definitely important to do periodical screening of the blood pressure, and also if possible at the home. Okay, coming to your question, what is the target? On the basis of recent study, there are a lot of international guidelines give different target. According to Indian guidelines, Indian hypertension guidelines, Indian Association of Physicians of India guidelines, the target is the BP should be below 140 systolic, 90 diastolic. Having said that, if somebody can tolerate the blood pressure of systolic less than 130, diastolic 80, that is the best thing, because the lesser the BP, it will be good. But at the same time, in a frail older individual, you should not reduce too much, because frail old age individuals, especially 80 years and all that, the systolic, if you keep it under systolic 150 by 90 should be okay. Again, one measurement is not fit for all. According to individual's comorbidity, age, sex, the doctor will advise and then say this is the target. And if suppose somebody can tolerate the blood pressure less than around 130/80, that is the best blood pressure, that is the best target. Because South Asians, especially Indians, are more risky people when they have hypertension. So it is always better to keep at 130/80. The ACC, American College of Cardiology, guideline says even for normal people, above 130 systolic and above 80 diastolic is hypertension. So normally optimal blood pressure for everybody is 120/80. And if you can control the hypertensive patient to around 130/80, that is the best treatment.
All right, Dr. Mandeep Saini, diabetes and hypertension both are independent risk factors for kidney damage. So how serious would it be if both of these factors are present simultaneously?
Uncontrolled hypertension and diabetes can lead to renal failure. Basic function of kidney is to filter blood and to remove waste from the body in the form of urine. High blood pressure can lead to narrowing or constriction of blood vessel, eventually reduces blood flow to the kidneys, leading to nephropathies and renal failure. We have seen 26% of renal failure patients are hypertensive. Similarly, there are many filtering units within each kidney. High glucose level or diabetes can damage all these filtering units, can lead to nephropathy and renal failure. We have seen 38% of renal failure patients are suffering from diabetes. And we have also seen 40 to 44% of patients with renal failure are suffering from both the diseases, hypertension as well as diabetes. So we have to strictly control our diabetes and hypertension to prevent nephropathies or renal failure, because both of these diseases together can damage our kidneys at very fast rate. So we have to control our blood sugar levels and our blood pressure.
All right. So that's how we can prevent damage to our kidneys. Dr. Muruganathan, now people with hypertension always get worried about doing exercise. They have a misconception that after exercise, their blood pressure may increase. What exercise would you suggest for people with hypertension, and how much time should they exercise every day?
Yeah, there is a myth, as you said, exercise may increase the blood pressure. It is wrong. Actually, when you do exercise, it will reduce the blood pressure, it reduces the cholesterol, it reduces weight, and also it reduces diabetes. So making exercise a habit can help lower your blood pressure. Not only that, by doing exercise, you get lot of good things happening. Your mind is free, your mood is elevated, your sex health is improved, it improves sleep, boosts immune function, boosts your energy, improve your mood, tone your legs, and also eases the joint. It creates a creative thinking. There are 3 types of exercise one can do. One is called aerobic exercise or cardiovascular exercise, where, for example, walking, jogging, jumping, rope bicycling, cross country skiing, skating, rowing, high or low impact aerobic swimming, and water aerobics. All these exercise, you should start in a warm up. You don't start straight away aggressively. You start warm up, and then you increase slowly, and then moderate exercise, moderate brisk walking for 30 minutes to 40 minutes every day. 5 days a week, if you do, that is the best exercise. Suppose if you want to do strength training, like you can strengthen the muscles. Now the new guideline says for hypertensive patients, especially elderly patients, you must strengthen the muscles also. And then stretching makes your muscle flexible. So whatever you do, you should do under the care of the doctors. Suppose if you are a hypertensive patient with cardiac problem, if you are a hypertensive patient with some risk factors, always consult the doctor. And before you do that, you check the your physician, do a ECG, do a echo, what sort of exercise you can do. Straight away, you cannot go to gym and then start doing weightlifting or push-ups and isometric exercise. These exercises should be done under a precaution, under monitoring, under the advice of the doctor. Some people, especially post-COVID, they just like that, they go aggressively do exercise. Especially post-COVID, go slow. At least for 3 months after post-COVID, don't do aggressive exercise, do gradually. For example, you start walking for 5 minutes, then 10 minutes, then 15 minutes, then 30 minutes. So all of a sudden, don't do exercise aggressively. Warm up is the key. And whenever you have an elderly patient and heart problems or any associated risk factors, consult the doctor before you doing the gym. You don't need to go to gym. You can do just walking, brisk walking is good enough.
All right, Dr. Saini, now, talking about young people and hypertension and also, risks to them. Recently, you've had cases of younger people in the sense in their 40s, exercising and having a cardiac arrest or having a heart episode. And what can you tell us about this and what sort of precautions one must take? Because clearly, many people could have the start of hypertension and they're not really aware of it.
Youngsters want to achieve results very quickly. It came to our notice that they are using steroids and high intake of protein for bodybuilding. They should go through proper heart checkups before going to gym. They should perform all the exercise under proper guidance of their coach and should take proper diet plan. Nowadays, youngsters are using alcohol, smoking and junk food. All these factors are responsible for cardiomyopathies and heart attacks. So we should make proper diet plan, and our exercise plan by the coach should go through heart checkup before going to gym.
All right, thank you so much, Dr. Muruganathan and Dr. Saini, for joining us on the program and answering all those questions for us. Thank you for watching. Goodbye.